The Scottish Parliament governs the NHS in Scotland. They assign health priorities and objectives for the boards to focus on. The Cabinet Secretaries and Ministers are accountable to the Government. The Scottish Government Directorate for Health and Social Care undertake health policy, the administration of the NHS, community care and some responsibility for social work. There are 14 area NHS boards and 8 special health boards. These 14 area boards are accountable to Scottish Government ministers. The area boards are responsible for the protection and the improvement of their population's health and for the delivery of frontline healthcare services. They plan and commission a variety of hospital and community health services, including services provided by GPs, dentists, community pharmacists and opticians. The Specialist Health Board provides services nationally, supporting the area boards. NHS Education for Scotland is responsible for education, training and lifelong learning for the NHS workforce. NHS Health Scotland is responsible for improving population health and reducing health inequalities. National Waiting Time Centre receives referrals in a number of key therapeutic areas in an attempt to reduce waiting times. NHS 24 is an online and telephone-based information and advice service. The State Hospitals Board for Scotland provides high-security care for patients with mental disorders who are unable to be treated in any other setting. NHS Healthcare Improvement Scotland is responsible for improving the quality of care in the NHS. They provide advice and guidance on effective clinical practice and set standards for care whilst reviewing and monitoring performance. NHS National Services Scotland provides a range of support services to complement the area and specialist boards, such as the Scottish Blood Transfusion Service. The NSS provide expert advice to NHS Scotland to help provide the highest quality healthcare environment and equipment. They also provide business support for the area health boards. The area and specialist boards work together to plan and commission specialist healthcare services, such as heart, lung and neurosurgery. A number of local services are also shared between boards to maximise efficiency. The community health partnerships aim to improve integration between health and social care by responding to local needs. Community health partnerships aim to shift the balance of care away from acute services and towards community-based services. The Scottish Intercollegiate Guidelines Network develops evidence-based clinical practice guidelines for NHS Scotland. This helps to meet the aim of reducing variations in practice and improving patient-centred care. The Scottish Medicines Consortium provide advice on the clinical and cost-effectiveness of newly licensed medicines, or new formulations of existing medicines and new indications for established products. SIGN and SMC work together to ensure that NHS Scotland receives the same information, and the final decision on the availability of medicine on the NHS lies with the area board. Funding for NHS Scotland is from the UK Government pot. A proportion of this is given to the Scottish Parliament, who then decides how much should be allocated to NHS Scotland. The area boards control the majority of the NHS budget. There are 4 core services offered in Scotland alongside locally commissioned services. The Minor Ailment Service allows patients to visit their local pharmacy and receive treatment for minor medical conditions without any charge. The Acute Medication Service covers both repeat and acute prescriptions, which are processed electronically, and the claim is sent electronically for reimbursement. The Chronic Medication Service aims to improve patient care and joint working between pharmacists and GPs. This service allows the pharmacist to manage a patient's long-term medication for either 24 or 48 weeks, following an agreed pharmaceutical care plan. Within the Public Health Service, pharmacies are expected to encourage health promotion. 2 services are provided as part of the PHS: smoking cessation and emergency hormonal contraception. Additional services can be decided at a local or national level. National services include an ostomy service. Some local services include harm reduction services and medicines waste collection. In comparison to England, there is a greater variety of core service on offer in Scotland. The new medicine service is offered in England but not in Scotland, and has been shown to increase patient compliance. NHS Scotland has been avoiding the privatisation of services, whereas NHS England has been commissioning an increasing number of services from the private sector. In Scotland, patients don't have to pay for their NHS prescription medications. The medications available in Scotland on the NHS may differ from England due to differing effective clinical practice guidelines. Thank you for listening.